Hello, we are group number 1, and the complex chronic condition we have chosen to research and present is type 2 diabetes. Now we will delve into the outline for our presentation.
The following is an outline for our presentation. First, we will be describing how type 2 diabetes fits with the definition of a chronic disease. Next, we will talk about the descriptive epidemiology of type 2 diabetes. We will then move on to talking about the characteristics and symptoms of type 2 diabetes. After that, we will describe why diabetes is a complex disease. Next, we will be describing a strategy that can help manage diabetes called bariatric surgery. Finally, we will determine the effectiveness of bariatric surgery by looking at an RCT that was published in the Journal of the American Medical Association. We will also critique the RCT using the Pedro criteria.
In this section, I'll be describing how diabetes fits the criteria of chronic disease. Diabetes develops slowly over time and progresses in severity. According to Diabetes Australia, diabetes is progressive because over time insulin becomes resistant and thus less effective in converting glucose into energy. Diabetes also correlates to neuropathy, retinopathy, and stroke. In some cases, diabetes can progress to death. Diabetes cannot be cured. However, diabetes can be managed through exercise, diet, and medication. For example, eating a diet consists of vegetables, fruits, and whole grain, nuts, and legumes can regulate blood glucose. Regular exercise can lower blood glucose level by contracting the muscle, which draws blood back into cells. Lastly, taking timely medication can also regulate blood glucose. Diabetes can impair the cognitive and physical function and thus reduce the quality of life of an individual. For example, diabetes can lead to physical disabilities such as foot amputation and loss of vision. Type 2 diabetes is also correlated to cognitive decline. Patients with type 2 diabetes have shown decrease in verbal memory, processing speed, delayed recall, and attention. Patients with type 2 diabetes is often correlated with dementia and Alzheimer. Furthermore, patients with diabetes are twice more likely to have depression, which impairs their daily lives.
So now I'm going to talk about the descriptive epidemiology of type 2 diabetes. According to a review article published in 2012 in the Oman Medical Journal, the number of people living with type 2 diabetes is increasing in all areas of the world, with 80% of these people living in low and middle income countries. But we have to keep in mind that the incidence of diabetes still varies according to the country because of different lifestyle and environmental risk factors. This is reflected in the World Health Organization's Global Report on Diabetes. This report, which was published in 2016, mentions that type 2 diabetes is found most frequently among low-income people in high-income countries, which is in contrast to low and middle-income countries, where the people who generally develop type 2 diabetes are those who are wealthy or have a high income. A characteristic that's strongly related to developing diabetes is being obese or overweight. Unfortunately, the number of obese and overweight people has been increasing in almost all countries of the world, which correlates with the rise of type 2 diabetes. Another factor that influences the development of diabetes is age, which you can see in the following graph. This is a graph created by the Public Health Agency of Canada based on national diabetes data collected from 2013 to 2014. And if you look at the graph, you'll see that most of the cases happen in middle age to older adults. So this shows that the onset of type 2 diabetes typically happens around or after the age of 40. One thing I want to point out is that this graph is showing all new diabetes cases, not just type 2 diabetes, but the Public Health Agency of Canada does note that 90% of adult onset diabetes is type 2. So the rise in cases that you see in the adults on the graph is for the most part a rise in type 2 diabetes, and the cases that you see on the left, so the new child and youth cases, are representing mostly type 1 diabetes. Another trend you'll notice when looking at the graph is that there's a difference in developing diabetes based on your sex. So men, who are represented by the dark blue bars, almost always seem to develop more cases of diabetes than women, especially when you're looking at the age categories where type 2 diabetes is more common. This shows that if you're male, you have a greater chance of developing type 2 diabetes. Some other characteristics that can increase a person's chance of developing type 2 diabetes, according to the Diabetes Canada website, are the ethnicity and their family history. So ethnic minorities are more likely than the general Canadian population to develop type 2 diabetes. These include people who are of Asian, South Asian, Hispanic, Aboriginal, or African descent. In terms of family history, People who have a close family member, such as a parent or a sibling, with type 2 diabetes also have a greater chance of developing this disease. There are also certain health complications that are associated with an increased likelihood of developing type 2 diabetes. One of them is having given birth to a large baby, which means a baby who weighs more than 9 pounds at birth. The presence of gestational diabetes while pregnant is also a risk factor. In addition, people with high cholesterol or other fats in their blood, as well as high blood pressure, are also at greater risk of developing type 2 diabetes. A diagnosis of PCOS, which is short for polycystic ovary syndrome, or a diagnosis of obstructive sleep apnea also makes developing type 2 diabetes more likely. Finally, having a psychiatric disorder, such as bipolar disorder, schizophrenia, or depression, also correlates with an increased chance of developing type 2 diabetes.
Now I'll be discussing the characteristics and symptoms of type 2 diabetes. When you first think of diabetes, many people often think of high blood sugar. This sugar, also known as glucose, is the main source of energy for the body and comes largely from the food we eat. Insulin, a term which also often comes to mind when discussing diabetes, is a hormone produced by the beta cells of the pancreas. In a healthy body, when blood glucose levels get too high, such as after a heavy meal, insulin causes the cells to intake glucose and use it as energy or store it as fat. This process allows for a reduction in blood sugar levels to a normal amount. Type 2 diabetes, which is also often referred to as type 2 diabetes mellitus, adult onset diabetes, or non-insulin dependent diabetes mellitus, is a chronic, often debilitating, and sometimes fatal illness of the endocrine system, in which the body cannot properly use the insulin it produces. This is also often referred to as insulin insensitivity. This is because, while the insulin may be present and produced by the beta cells of the pancreas in a normal fashion, the insulin receptors throughout the body do not recognize the hormone. As a result, the blood glucose levels will increase. This is known as hyperglycemia. Additionally, a lack of glucose in the cells and tissues can cause systemic effects as a result of damage to organs, nerves, and blood vessels, as we will see on the next slide. Now I'll be discussing some of the symptoms of type 2 diabetes. These symptoms often develop slowly and gradually over the course of several years. This can make spotting the signs or symptoms very difficult, as they can be so mild that you may not even notice them. In addition, many people may initially not display any symptoms of diabetes, or may only discover that they have the illness after showing symptoms of a comorbidity, such as vision problems, or perhaps after a general health screening. The classic symptoms experienced by individuals with type 2 diabetes are listed on the slide, but I'll go into some more detail regarding each one further on. It is important to note that many of these symptoms are common between both type 1 and type 2 diabetes mellitus. The first symptom I will be discussing is fatigue. Individuals with type 2 diabetes often express feeling tired or fatigued throughout the day, particularly following meals, and this can be attributed to the lack of glucose being absorbed in the body cells. Additionally, they may experience polyphagia or increased hunger. This is because if there is an inability of insulin to move glucose into the cells, the muscles and organs will become depleted of energy, resulting in intense hunger. Polyuria, increased urination, and polydipsia, increased thirst, may also occur due to the excess glucose buildup in the bloodstream. Elevated blood glucose levels also cause fluid to be pulled from the tissues, and this leaves you thirsty. As a result, you may drink and urinate more than usual. If your blood sugar level is too high, fluid may be pulled from the lenses of your eyes, resulting in swelling, which affects your ability to focus and can cause blurred vision. Additional retinal problems may occur if the diabetes is not managed correctly. Elevated blood glucose levels also limit the body's ability to heal and can make the individual more susceptible to infections. Individuals suffering from type 2 diabetes may suffer from sudden and unexplained weight loss as well. The reason for this is because without the ability to metabolize glucose, the body will use alternative fuels stored in muscle and fat, and calories are lost as excess glucose is released through the urine. Individuals with type 2 diabetes may also have patches of dark velvety skin in the folds and creases of their bodies, and this is usually present in the armpits and neck of the individual. This condition, known as acanthosis nigricans, may be a sign of insulin resistance. Paresthesia, or numbness and tingling of the hands and feet, is also experienced by individuals with type 2 diabetes, because the increased blood glucose levels damages nerves and blood vessels.
So I'm going to be talking about the complexity of type 2 diabetes. Diabetes doesn't have a single genetic cause. It's likely associated with the effects of multiple genes in combination with lifestyle and environmental factors. It's also impacted by psychosocial factors. So the complexity also depends on socioeconomic status, the culture, environment, and patient behavior. The condition can be caused by multiple contributing factors, and therefore it's a complex disease. Usually a primary condition associated with the presence of coexistent diseases, which may have an immense impact on the individual. Potential complications include neuropathy, which is nerve damage, nephropathy, which is kidney damage, retinopathy, eye damage, hearing impairment, skin conditions such as bacterial and fungal infections, as well as Alzheimer's disease. As well, diabetes does require higher healthcare utilization, which is another reason why it's a complex disease.
Technology plays a big role in the way medicine and treatment are performed. Revolutionary rehabilitation treatments such as bariatric surgery is a powerful tool against obesity and type 2 diabetes. In an article by BMC Endocrine Disorders, it talked about how this treatment targets metabolic regulation. The term metabolic surgery is used to describe the types of weight loss modalities which involves an anatomical bypass of the upper gastrointestinal tract and functional remodeling of the intestine. The most unique aspects of this procedure include restrictive, malabsorptive, or combination of mechanism techniques. In addition, the article mentions that the upper gastrointestinal tract bypass is a major role in determining the magnitude of weight loss and metabolic outcomes. Weight loss amongst diabetics is important since it allows control over blood glucose levels. Metabolic surgery is able to maintain weight loss through caloric restriction, increased meal-induced thermogenesis, and modulation of hypothalamic circuits.
Bariatric or metabolic surgery may present as an emerging medical intervention for diabetes. However, limitations of the bariatric or metabolic surgery may outweigh the benefits, which is why the application of these procedures is not yet widely implemented. To evaluate the internal validity of the study, we will use the Pedro criteria. This study scored a 4 on the Pedro scale, which reflects a fair quality of the study. One must remember that this score excludes the first criterion because it does not relate to the internal validity of the study. The criteria in which the study met are as follows. The eligibility criteria was met as the source of subject was clearly stated from the University of Pittsburgh Medical Center. The list of criteria included 61 adults aged 25 to 55 years with a BMI of 30 to 40 and a diagnosis of type 2 diabetes confirmed by plasma glucose level of greater than 125 milligrams per deciliter and or with treatment of glucose-lowering medications. The fourth criteria was indicated through the severity of the condition being treated, which was according to the plasma glucose levels. A key outcome measured at baseline was of the type 2 diabetes remission, which were defined as either partial or complete remission. The study also met the 8th criteria as 52 out of 61 participants were successfully evaluated for the assessments, and the 9th criteria, as the report clearly stated that the analysis was conducted with an intent to treat population. And also, the 10th criteria was met as the comparisons were measured between 4 groups. So it was 2 main groups, a surgical procedure and a lifestyle intervention group, and each group was divided into 2. The criteria that were unclear on the Pedro scale are as follows. So criteria number 2, the study did not clearly state use of randomization to allocate participants to specific groups. And 11, although the study provided both point measures and measures of variability within the study, the outcomes that were measured were only for 3 of the groups and was missing 1. It excluded measures for the low-level lifestyle intervention. The criteria that the study failed to meet were criteria 3, 5, 6, and 7, as there were no blinding of any individuals involved in the study. As the study required follow-ups, participants were required to provide written informed consent to participate, therefore being aware of eligibility and inclusion in the trial. Participants who underwent surgery were informed, and so were the individuals participating in the low-level lifestyle intervention program. As previously mentioned, the effectiveness of the bariatric surgery still remains unknown, which may contribute to the difficulty in collecting participants for the study. Overall, the study concluded that the low-level lifestyle intervention resulted in more disease remission than the lifestyle intervention alone. The uncertainty of the effectiveness of bariatric surgery for treatment of type 2 diabetes still remains unknown.
So, to reiterate, type 2 diabetes is a chronic disease that progresses in severity and in some cases can progress to death. It can be maintained through diet and exercise, and in some cases related to weight loss, even reversed. Medication can also help moderate blood glucose levels. This is a disease which is increasing globally and is more prominent in low and middle income countries, ethnic minorities, people who are overweight or obese, and in people who have a family history of diabetes. Diabetes, we learned, can cause a variety of associated health complications. Unfortunately, symptoms develop slowly over the course of many years, and at first can be confused with other illnesses. Some of these vague symptoms include fatigue, headaches, and dehydration. Some of the more telling symptoms include polyuria, blurred vision, slow healing wounds, and frequent or recurring infections. This is a disease that requires higher healthcare utilization resulting from its complexity. Type 2 diabetes may be caused by multiple contributing factors including socioeconomic status, culture, environment, and patient behavior. A rehabilitative strategy, which we discuss for obese patients suffering from type 2 diabetes, includes bariatric or metabolic surgery. The benefits from this type of surgery include sustained weight loss and improved control of blood glucose, which in some patients can lead to the reversal of type 2 diabetes. However, the surgery and study using the PEDRO criteria only received a 4, which is fair quality, but not high quality. The best way to combat this chronic disease is to try and prevent it from occurring altogether through a well-balanced diet, regular exercise, and a healthy BMI. This concludes our presentation on type 2 diabetes. Thank you for listening, and we hope you enjoyed it.